Patients who still experience pain or discomfort after knee replacement frequently receive the advice from their doctor that they should strengthen their knee with exercises. And many patients struggle with that advice because they experience that when they do the exercises, the knee even hurts more. And in fact, that is not illogical, because when you strengthen your knee muscles, you obviously load the knee, which was already somewhat painful. So it is therefore understandable that these exercises make you hurt even more. And it is therefore important, I should say very important, that when you strengthen your knee with exercises, that these exercises cause the least amount of overloading to the knee joint itself. And there is one exercise that is particularly well suited for that purpose. It is called the straight leg lift. Actually, it is a quite simple exercise, and the name says what it does. You lift the leg while keeping the knee straight. The easiest way is to sit in a lazy chair or sofa, slightly leaning back, and to lift the leg slowly upward to 30 to 45 degrees, while keeping the leg fully straight. As such, the knee is kept in extension and is only minimally loaded, since the knee joint itself is not moving, and therefore this exercise will not hurt or overload your knee replacement. Once you have reached 30 to 45 degrees, you slowly bring the leg down while keeping muscle tone and holding the knee straight. And do both directions slowly, 3 seconds up, 3 seconds down. Don't let the leg fall when coming down. Use your muscle power to come down slowly. That is important, because this going down phase is really important for building up strength. So, when should you start with this exercise? The ideal time to start is around 6 weeks after the operation. Earlier is not needed, since the knee first has to recover from the surgery and has to settle in terms of inflammation and swelling. Ideally, you should execute 10 consecutive lifts, 3 seconds up, 3 seconds down. Then take a 1-minute rest, and then repeat 10 lifts, 1 minute rest, and another 10 lifts. So, 3 sets of 10 lifts, with 1 minute rest in between. So in exactly 5 minutes you are done. Start with one such session a day, for example in the morning. When you gradually become stronger, increase to 2 sessions a day, in the morning and in the evening. And eventually 3 times a day, in the morning, after lunch and in the evening. That will make your knee and your leg stronger in the safest way, without causing overload. Once you manage this, you can then gradually proceed to somewhat more aggressive forms of strengthening. But first, make sure you master this exercise sufficiently well, because it is the safest and most efficient strengthening exercise to start with. Thank you for watching.